This past weekend, the White House tried to discredit the head of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, from the leak of a report detailing Fauci's alleged missteps regarding the virus response to a White House staff member posting a cartoon mocking him. Look at Fauci's suggestions. Have they been reasonable? Also, what does Trump's distrust of experts mean for health and science in the U.S. moving forward? To discuss all this, we're joined by Dr. Zhiwei from the Center for Public Health Research at the Medical School of Nanjing University, and Brendan Blackburn-Dwyer, president of Grasshopper Strategies, who joins us from Philadelphia. Welcome to both of you, gentlemen. The White House is basically alienating the country's top infectious disease expert, Dr. Anthony Fauci. Fauci said that the last time he saw the president was June the 2nd, more than a month ago. Brandon, let me go to you first. What do you make of all this?
Well, let me first start with a statement you made at the top of the show. That does this show that Trump doesn't respect certain scientists? I think that it shows a continued lack of respect for any scientist, any fact, any reasonable advisement from the experts that are supposed to be leading our nation in a time of pandemic and setting a global standard. Instead, we have a White House and a president determined to listen only to sycophants, to listen only to people that tell him exactly what he wants to hear, to continue to deny any sort of fact or reality at a time when the United States has 138,000 confirmed deaths from COVID-19 and almost 3.5 million active cases. The discrediting of Anthony Fauci follows a very standard procedure for the Trump administration, which is when they think they can use someone, they praise them. This goes all the way back to the beginning of COVID-19 when President Trump praised China's handling of the early days of the outbreak. And then when it became politically expedient to blame China for the problems that he helped cause through his inaction in the United States, he then turned on China. The same thing has been found on different advisors, different chiefs of staff, different members of different agencies, and now the same policy and practice is in place with Dr. Fauci, where President Trump praised him for months, considered him a good man, and is now leading a overt and covert effort through his senior advisors to discredit him just so he can continue to lie to the American public about the real risk presented by this pandemic.
Right. Dr. Wu, you are a public health expert yourself. How do you feel about all this, the fact that the White House is alienating the country's top public disease expert?
Well, actually, you can see it's a very strange thing that, and the top infectious disease expert actually is mocked in the public. If you look back, the timeline actually from February this year, actually, Dr. Tony Fauci and Mr. Trump have been really disagreeing on many issues, like how severe the pandemic is and how many testing actually are being conducted, and also all the various different public health containment measures should be implemented. So apparently, actually, they don't really agree on many things. Based on their relationship in the past, apparently, Trump wants to have his own way, and basically implement his own policy for certain political gains. So Dr. Fauci, basically, from his professional capacity, proposed many different recommendations on how to contain the virus spreading and taking certain measures to decrease the disease spreading. So apparently, there are so many differences. So I'm not really surprised right now that Mr. Trump and his top officials are actually taking measures to sideline Mr. Trump and other public health experts.
Right. Talking about public naming and shaming, Brandon, let me go to you. A high-ranking White House staffer shared a cartoon on social media mocking Fauci and his handling of the pandemic. I want to show you this graphic. Basically, this staffer of the White House said, "Sorry, Dr. Faucett," exclamation mark. "At least, if I'm going to disagree with a colleague such as yourself, it's done publicly and not cowardly behind journalists with leaks. See you tomorrow." When an administration official insults his top officials in public health in such a way, what sort of signal do you think this is sending to the public and indeed the world?
Confusion and obfuscation. The Trump administration and its senior officials continue to double down on basically its long-standing campaign to question any verifiable source of fact and information, right from its early on alternative facts representing the day that President Trump was sworn into office to through today on the pandemic. Their policy has been one where they basically try to convince the American public that no one is trustworthy. This allows the president to continue to say misaligned statements, say things that he contradicts himself minute to minute, moment to moment, even in the same press briefing. And it allows him basically to say, well, hey, I'm not the only one lying, everyone's lying. So you shouldn't listen to anybody. And as we get through this, we end up with a bifurcated public that is split along political ideologies that result in only 34% of Republicans saying that they are likely to wear a mask in public, while 94% of Democrats said that they are likely to wear a mask in public. That is an insane split that should have been about scientific fact and medical fact and leadership from the president, from people like Dr. Fauci, but has become a political and cultural war between two different spectrums of the politicians that basically have put people at risk by the president just wanting everyone else to be wrong, because he believes that if he can just convince everybody else that everyone's lying to them, that they will come around and somehow support him in November for re-election.
Right. Dr. Zhu, I want to borrow your expertise because an unnamed White House official cited by Washington Post said that there were concerns about the number of times, quote, Dr. Fauci has been wrong on things. Do you think such statements, such accusations are valid? Have Dr. Fauci been wrong on certain occasions? Dr. Zhu, sorry, Dr. Wu.
Actually, I think you have to look at it in the perspective ways that this is a new virus and we do not really know much about it. One of the problems is that like in early phase that we don't really know how it was transmitted and how effectively it was transmitted. So essentially, for the public health expert, you really have to, based on the facts, and then develop your professional capacity and telling people what to do, what not to do. And I mean, I'm not surprised that in the early phase that Dr. Fauci made some mistakes. But later on, the point is that later on, when he has evidence and he corrected those, he proposed some corrective measures for containing the virus. I think this is the right way to move ahead. Basically, it has to be scientific evidence-based approach instead of simply, driven by certain political needs, certain ideological needs. I think, this is something actually we have to bear in mind. We're dealing with a virus which we do not know much about it.
Right. Brandon, I want to go to you, to the point you mentioned earlier about the politicization of a COVID response. You basically said that the two parties cannot agree on pretty much anything right now, on wearing a mask or not, on reopening the economy or not. It seemed that many Republicans are pushing for a quick reopening, whereas many Democrats caution against it. How do you think the ongoing partisanship in Washington, to what extent has it delayed response efforts in the U.S.?
Well, I'm going to quote Dr. Fauci, who had a live stream with Georgetown University yesterday, referenced that while we need national and unified leadership during a time of pandemic, that we may have seen some substantial failures in the way that our governments and our states are organized. Usually, the decentralization of power in the United States helps us adapt and change and be able to conquer problems very quickly and with local guidance. What we've seen instead, though, is Republican governors felt loyal to President Trump over the last 6 months and basically either kept their states open or reopened very, very, very quickly, ignoring all scientific advice from the national government and their local doctors, and we're seeing people pay the price. We're seeing Florida, for example, become the epicenter when it's led by a Republican governor who basically made a name for himself over this last 6 months nationally by denying all scientific evidence that the coronavirus was a serious threat. And now he is being forced to actually put parts of his state back under actual lockdown. Why? Because thousands of people are being infected every single day. Hundreds of people are being hospitalized every single day. When we look at Dr. Fauci and his history of maybe statements that weren't correct, I agree with my colleague. When we look in context, yes, Dr. Fauci has acknowledged that he has learned, just as we all have about coronavirus, but further, we need to put them in context. 3 of his statements under attack by Peter Navarro, a leading Republican and trade advisor to President Trump, talked about Dr. Fauci's hesitance to advise masks. That was during a period early on where masks were desperately needed for frontline people, and a lot of civilians didn't need them but were buying them up, creating a supply and demand problem. Another issue was that the Peter Navarro attacked the fact that Dr. Fauci was saying, go about your life. This was back when we were measuring cases in the United States in the dozens, not in the millions. So Dr. Fauci and other scientific experts have evolved their opinions, their advice, and their findings on coronavirus as we've learned more and as the situation has changed. Unlike our Republican leadership in the White House and many of our Republican leaders across the country who have just continued to deny any realistic fact that would actually save lives.
It is a truly upsetting situation. Even looked at from this side of the Pacific. Dr. Wu, how do you look at the partisanship and America's response or lack of it to COVID-19?
Well, actually, it's getting increasingly complicated. You can see that it's completely polarized. The scientific community says that the pandemic is still not at the peak yet. It's going to be getting worse and worse if the current situation continues. In the political side, actually, the Trump administration says, okay, we have to open the city, open the business, and life comes back to normal. And basically, this is completely driven by political needs. And I suspect that actually it's largely driven by the re-election needs. So this actually makes the containing the virus, containing the pandemic very, very difficult. And you can see that the White House task force has been sidelined for a long time. And in early interviews that Dr. Fauci is saying that he has not seen Mr. Trump for 2 months. I mean, this is something actually Mr. Trump doesn't want to see him. I mean, basically, this is what's going on. I think the situation is it's getting pretty dire in the U.S. That you can see the resurging of the new cases in Florida, Texas, and other states actually is pretty bad. In April, we are saying that we almost reached the peak. Basically, that's what the administration claims. But right now, we're seeing 50 and even 60,000 new cases per day. So definitely, we need to do something actually to contain the spreading of the virus.
People are praying that there will be more respect for science and that things will turn for the better soon. I want to thank both of you, Dr. Zhiwei from the Center for Public Health Research at Nanjing University, and also President Brendan Blackburn-Dwyer, President of Grasshopper Strategies. Thank you both so very much.